I'm Dr. Tim Peel. I'm a family medicine physician here at Grand Itasca, and I've been here for about 24 years. And I am the program director of our brand new family medicine residency. Our hospital is kind of uniquely situated to support a residency in that we have family medicine physicians that do all aspects of care here. We have family medicine physicians doing OB care, inpatient care, emergency department care, clinic care. We also have a large enough volume that we can support a good educational experience for the residents. Our residency program is a 2-2-2 program, meaning we have 2 residents each year for 3 years. They will spend their first year of training at Woodwinds Hospital in St. Paul. After that first year, then they'll come up and spend their second and third years here in Grand Rapids. So in the second and third years, the residents will have a primary care clinic. They'll spend roughly half of their time in their primary care clinic, establishing their own patient panel and managing continuity of care. They will do 13 4-week rotations per year in everything from our emergency department. There are 3 rotations with our OB-GYN department. We have a 1-month hospice rotation, which I'm pretty excited about. That's a bit unique. And we also have a 1-month rural inpatient psychiatric rotation in Hibbing. On top of that, there are 3 elective months per year, and that allows the residents to choose anything from ophthalmology to administrative month to a procedures month to a month away. It's kind of wide open.
As Vice President of Medical Affairs at Grand Itasca, I help serve and support our medical staff. And as a medical staff, I'm very proud of. We have nearly 90 employed providers at Grand Itasca. We have a very strong primary care foundation, but we are definitely a large multi-specialty group as well, too. Grand Itasca has a long history in the Grand Rapids area. We've been providing care here for well over 100 years to our patients and community. And in my time here, it's been really fun to see our group expand healthcare in the community, which isn't true of a lot of similar-sized communities throughout the state. We've been able to expand the number and types of specialty providers on site. We've been able to, bring in our own pharmacy in the clinic. We have this beautiful building that's, 20 years old. So it's really exciting to be part of an organization that is not just surviving in healthcare, but really thriving.
Grand Itasca has allowed me as a family doc to practice all types of family medicine. It hasn't shoehorned me into one particular area. I practice clinic medicine, hospital medicine. I've worked in the ER. I've done administrative work. I've done teaching. So if you can think of all those different areas in which family medicine is utilized, this is a place where you can come and, to some degree, pick and choose and explore all those different options.
The culture of Grand Itasca is very supportive. We all want to take care of the patient. That's the goal of everyone. And in doing so, we cooperate with each other. There's not necessarily, that's not my job. There's, if it needs to be done and I'm capable of doing it, I will do it. People help each other out. It's very friendly. I just can't even say enough about how supportive it is here.
At Grand Itasca, one of the great measures of our culture of our medical staff is longevity, and I'm very proud of the fact that we have a lot of providers who have started their career here and end their career here. Most recently, I'm also proud when we have medical students, RPAP students, and hopefully soon residents that have been within our walls as part of their education that choose to come back and practice medicine and start their career with us at Grand Itasca.
Oftentimes we'll refer to each other as, our work family, and that's not just words here. We, over the years, have many episodes where that piece of having each other's backs is tried and true and played out.
As a hospitalist, residents will work alongside of us just like one of my partners would. providing hospital care so residents can see the patients, take history, do the exam, come up with plan orders, and if they need to consult with a specialist, do so as well. Really the ideal would be to take ownership of patient care.
When we start having residents at Grand Itasca, they will be part of our obstetrics team. They may be the first eyes on a patient who comes in labor or with some other concern during their pregnancy. They will be able to follow those patients through labor, follow them by doing procedures and assessments along the way, and certainly participating in their delivery.
The residents will be able to work one-on-one with not only our primary care group, but also our specialty group. You're not going to be in a group of several residents. You will be working side by side with the cardiologist, with the rheumatologist, with OBGYN, with helping deliver babies, covering the hospital, the emergency room, and seeing patients in our ambulatory care clinic.
This would be a great place to learn because you're the only resident. I mean, there will be 2 residents here, but there's a lot of preceptors to go around, so you will get hands-on experience consistently. You will be the one making the decisions and taking care of the patients.
One of the great things about where we live, we're in northern Minnesota. Itasca County has over 1,000 lakes. If you have a canoe and a healthy pair of legs, you can pretty much get to a body of water within 5 minutes of wherever you are. The opportunities to do anything water related are literally in the backyard of the hospital.
The community has many amenities that we really appreciate. My wife and son and I go mountain biking a lot, and we're very excited to have the Tioga Trails in town.
Here at Grand Itasca, we have an annual Running the Rapids race, and that you can do a 5K, you can do a half marathon, you can do it as a relay. I've been able to do all of those.
So one of the neat aspects of being in primary care that drew me to primary care was not only seeing patients in clinic, but being a part of the community. I really enjoy being in the community and running into patients in the grocery store, at the golf course. We're able to be involved in many community activities. It's really fun not only to be able to interact and help support our community within our walls, but to get outside of our walls and be involved intimately with our community.
Our community has a lot of resources going for us. We have a strong YMCA presence. We have a very robust food shelf. We have a free clinic in town. We're closely aligned with the Department of Public Health at the county level. Our hospital and our clinic are integrated into all of that so that it's part of a weave of health for the local area. And it makes me feel good to be part of that, and it makes me feel good to be part of growing that into something even more than what it is right now.